Good morning or good day, everyone. Nice to have you here. I'm glad that you could make it to the third Contagion Cultures webinar. It's July 21st, 2020. We're broadcasting from Queen's University in Ontario, Canada. Queen's was established in 1841 by an imperial royal charter on Anishinaabe and Haudenosaunee territory. Queen's is an example of the frequent invocation of imperialism in education. It's important for us to attend to the significance of this place for the Indigenous people who lived here prior to the colonial project and who continue to live here today, despite the genocide and assimilation in which our institution and our society is implicated. Contagion Cultures is a Faculty of Arts and Science collaboration between the School of Public Policy and the School of Policy Studies and Languages, Literatures, and Cultures, with Queen's Library providing substantive report. Queen's Contagion Cultures lectures help to make sense of this pandemic through the expertise and insights of arts and science faculty members. This public-facing series asks important questions and articulates multiple responses. It leverages the powerful tools of humanities analysis to grapple with our turbulent times. Today, it's my pleasure to introduce David Murakami Wood. David Murakami Wood is an associate professor in the Sociology department and cross-appointed in geography and a member of the Cultural Studies program. He is the former Tier 2 Canada Research Chair in Surveillance Studies and a board member of the Surveillance Studies Center. In March, he returned from several months in Japan, where he had been a fellow of the Japan Foundation. And his talk today is entitled Mindo, Face Masks and Fax Machines, Japan and COVID-19. And so we very much hope that you'll enjoy the talk, and we look forward to the discussion afterwards. And I'll hand it over to Professor Wood.
Thank you, Jennifer. I'll just see if I can share my screen properly here. What I'm going to talk about today is not a theoretical, heavy sort of talk. This is very much a descriptive and empirical piece. And it's answering some, or trying to answer, some very serious and timely questions, but not through the lens of medicine. In this case, I'm not a doctor in that sense, but really rather through sociocultural exploration of the COVID-19 phenomena, in this case in Japan, but I think hopefully with relevance elsewhere in the world. I have some acknowledgements here, first of all. As Jennifer mentioned, I was a Japan Foundation Fellow in late 1919, and the Japan Foundation effectively paid for me to be in Japan during this period and of course afterwards, where my time there of course overlapped with the onset of the pandemic in Japan. And so I became interested in this because I had to be almost straight away. I'd also like to thank Professors Kiyoshi Murata and Andrew Adams at Meiji University for giving me space there, and Queen's University for the sabbatical 2019 to 20. Discussions about this talk with a number of people, some of whom are particularly important: Kaio Murakami, Toshimaru Ogura, Midori Ogasawara, and Rochelle Kopp, and of course the members of the Facebook COVID-19 in Japan discussion group, which is full of interesting comments, conspiracy theories, paranoia, and sometimes good sense. I'd just like to say before I start that 2 short extracts from my work on COVID-19 in Japan will be published very soon. One in a collection called Data Justice and COVID-19, Global Perspectives by Lynette Taylor and others. And this will be available open access. That's free, easy to access from Meatspace Press, from that address, on the 1st of August in a few days' time. And also forthcoming in a special issue of Information Polity. There'll be other papers as well, I'm sure. So here's what I'm going to do today. I'm going to start with the Aso thesis, if one can call it that. Taro Aso, one of those people you love to hate, let's put it that way. He's the current Deputy Prime Minister and the Finance Minister in the current government, and a former Prime Minister, very briefly. He had to step down, as he has had to do many times because of things he has said. He was quoted on June the 4th in a ministry meeting as having said, "I often get phone calls from people in other countries asking, do you guys have your own special medicine or something? I told these people, between your country and our country, Mindo is different." And that made them speechless and quiet every time. as well it might, given that probably nobody has any idea what he was talking about. However, Mindo is really one of these complicated words that means whatever it feels like to anybody else who's listening in some ways. It's often translated as national character. It's essentially, in this context, especially when Taro Aso is saying this, it's a right-wing dog whistle, a kind of signal to those who are nationalists and supremacists in the Japanese political scene. Essentially says that Japan is better, different, superior to other countries, and therefore this is why Japan has done well in the context of COVID-19. Cheekily here, I'm going to ask, does he have a point? Japan does seem to have done well. At least that's what we're told in all the kind of conventional media. Japan has been one of those countries that people have said, especially amongst OECD nations, it's done well, hasn't it? So the question I'm going to ask first of all is, how can we tell if Japan has done well? What are the kind of measures we might want to use to look at how Japan has done? And how does it really seem that way in Japan to Japanese people? And then broaden it out to asking this question of, relative to who has Japan done well? Japan, of course, has had many COVID cases. This is across the whole of Japan, except missing out Okinawa, which is down to the south here. The red in the northern island of Hokkaido indicates an early outbreak that took place largely before any other part of Japan in February and March of 2020, when I was still there. Tokyo is the very dark red section right in the center of the map. And that's Tokyo has had, not surprisingly, the most cases and most deaths. We'll come back to that in a minute. One can see the general progress of the virus in Japan as being following a remarkably similar kind of accumulative number of cases as many other countries in the world. It's currently in the second phase. We'll come back to that in a second. And as you can see here, interesting enough, on June the 4th, if you look at the scale along the bottom, when Taro Aso made his statement about Mindo, Japan was indeed at the lowest point in its COVID-19 history. It's very easy to be confident when you're essentially in the eye of the storm, as we'll come back later. As we see here, soon after Taro Aso's statement, the number of cases started rising again in Japan, making it difficult to see what Mindo had to do with anything. As we can see here, confirmed case trajectories in different prefectures, states of Japan. And here in some particular places, Kanto is broadly the area of Tokyo metropolitan government covers, and the area around it, the major cities of Saitama, Kanagawa, Chiba, and others. So it's the big urban center of Japan. And here you can see large number of deaths, which are increasing at the moment compared to other places in the country. It's worth noting before we go on, though, that Taro Aso isn't the only person to have his version of Mindo. Western analysts, indeed, are often noted as having their own version of Mindo when it comes to Japan. Tessa Morris Suzuki famously called it techno-orientalism. It's a combination of stereotypes, both long-standing and more recent. The perception of Japan as uniquely organized and efficient, for example. The idea of Japan being a future-oriented country, especially in government terms, and somehow this natural affinity for high technology, particularly robots. And you see this all the time when it comes to amusing stories on television and so on about Japan and its robots. Japan has all these funny robots for all these funny purposes. It's curious, it's different, but somehow uniquely Japanese in this context. This particular kind of stereotype emerged during the bubble economy period. This is the period of rapid economic growth in Japan, 1970s to 80s. And ironically, prior to this, the Western stereotypes of Japan had been predominantly a traditionalism, an adherence to old values and codes, high culture, or alternatively, vicious and savage barbarism during the Second World War, and of course, way before that, during the samurai period. So these kind of stereotypes have come and gone. But it's clear, as we'll see, that the stereotype of the techno-orientalist efficient governments with its natural affinity for technology really does not hold in the context of COVID-19. So not only will we challenge Taro Aso's Mindo, we will also challenge the kind of techno-orientalist stereotype that comes from the West, which I've seen so often in the reporting on Japan in this period of COVID-19. it gets challenged straight away, actually, very early on in the pandemic in Japan. The perception of competence was hit very hard by the Diamond Princess debacle. Now, some of you will remember, casting your mind back to February and March, when this cruise ship, the Diamond Princess, which had many people from different countries on board, was forced into quarantine in the port of Yokohama near Tokyo. For a while, it seemed to be under a media blackout. Shinzo Abe, the Prime Minister's government response to the Diamond Princess quarantine was to release as little information as possible about what was happening during that time. It got very frustrating for people in Japan, as I was at the time, and for foreign media who wanted to find out what was going on so they could report accurately on the threats, the situation, who was infected, who was dying, and so on. A noted epidemiologist from Kobe University, Kentaro Iwata, got essentially a volunteer position on the ship, even though he was a senior professor, and revealed an almost farcical situation on board. He said in a couple of famous YouTube videos he made, there was no containment and separation measures. There was a lack of protective equipment and clothing. There was an entirely unclear and opaque chain of command, and so on. In fact, he argued that this was a situation of almost complete incompetence. He was actually asked to leave by those who were running the quarantine, and his complaints to the government were so rebuffed that he made videos in English and then had a press conference with the Foreign Press Club in Tokyo, not with the conventional Japanese media club. Of course, this was an entirely chosen tactic in a sense, because he rightly perceived that Abe, as a prime minister, was more concerned with the image of Japan overseas than he was about the image of the quarantine within Japan. And the response to this was immediate. There were changes to practice promised both in the Diamond Princess, but also more broadly in the emerging pandemic within Japan. But of course, and this was typical again of the Abe government's response, over $50 million equivalent, US dollars equivalent, dedicated to improving Japan's image overseas when it came to the pandemic. So of course, you know, rather than actually dealing with the situation as it was directly head on, instead, we will try to pretend everything is okay in more effective ways. It's interesting because early on during the pandemic, Abe had already been accused of taking very little action by people who knew what was going on at the time, which was not many people in January at the time. So when the situation in China was becoming clearer, the Abe government took no immediate action. In fact, there were even encouragements from the Abe government for Chinese tourists to visit Japan during the Chinese New Year celebrations at the beginning of February. Japan also ignored the World Health Organization call for testing, testing, testing. If you remember that slogan they went for at the beginning of this period. Instead, and this was a scientifically justified approach, although there was a lot of arguments about it, they went in for a cluster tracing approach. Later, this was rebranded in a media strategy as super cluster tracing, but it's the same thing. Essentially, this means tracking the person who's been identified as having COVID-19, their connections, their history, and so on, and tracking down all of those people. This was fine in the early stages when there were isolated cases in Tokyo and when the outbreak was confined to the northern island of Hokkaido, the major outbreak from February to March 2020. However, this also came along with a strategy which prevented local doctors and patients, or strongly advised local doctors and patients, from getting access or giving out the polymerase chain reaction test, the main test that we have for COVID-19, except if someone had contact with COVID-19 themselves and knew it, or had been to Wuhan in China. So if they'd had contact with a person with COVID-19 or had been to China itself. Now, the thing is about this, of course, as we all know, and we knew then, by the way, and just as we know now, that most people who'd had contact with someone with COVID-19 will not have known it. Asymptomatic transmission was realized early on in this pandemic. So the idea of cluster tracing works very well if you are 100% sure, or pretty sure, that you've got all the people who have COVID-19 and can trace their connections. But of course, we could not be sure. There were also persistent accusations from pretty senior doctors, including especially Shinji Shimada, the president of Yamanashi University, the state was deliberately making it as hard as possible to obtain a test, but also encouraging doctors to diagnose COVID-19 cases as the secondary conditions it generated, that is pneumonia, pleurisy, and so on. So if they had a patient with COVID-19 symptoms, to diagnose the case of the symptoms as opposed to the underlying condition. So many people were diagnosed with pneumonia, with pleurisy and such like, instead of being diagnosed with COVID-19. This was a really controversial accusation at the time, and there was lots of arguments whether it was true or not. There's still arguments about whether it was true or not. But indeed, this seemed to amount to some kind of suppression of infection data. Shimada also made the accusation that causes of death were being actually therefore misrecorded because of them being diagnosed as a symptomatic condition as opposed to the underlying cause. So people were being diagnosed as having died of pneumonia or pleurisy and so on. This actually has been backed by various accounts on social media by Tokyo residents, which I've seen, and I've got a whole library of these, of, not just attempts to deceive according to the cause of death, but also attempts to obtain tests, which were very, very difficult to obtain. And when people were able to obtain them, it was like some kind of Cold War spy movie, with people being moved in blacked out vehicles, entering by back doors, being told by nurses never to reveal the location of the testing site, and so on. It's completely the opposite of, for example, what was done in South Korea or in Taiwan with drive-through testing centers and massive public encouragement for people to seek testing. So because of this, or because of the fact that Japan was successful, Japan's figures delivered to the WHO look good compared to other similar economies. However, we weren't able to assess how good these figures were independently until May 2020, because the government did not allow the public or even non-governmental researchers who did not have official permission to see any of the raw data. So that suspicion that real numbers of infections and deaths were being played down reflected a low testing rate continued and persisted. The Tokyo Metropolitan Government and indeed other governments are now releasing full figures. We'll come back to what those show in a second. Well, right now, in fact. So from late May, finally, the National Institute for Infectious Diseases released an assessment for Tokyo, which was an assessment for 5 weeks dating from February the 17th, when the pandemic really started to hit Tokyo, the first wave. And this showed an order of magnitude difference between the official deaths and the excess mortality that occurred over this period relative to the normal curve of mortality that would take place in these months in any other year. So the official figures showed 16 people had died as a result of the pandemic, but there actually were an excess 50 to 60 deaths per week, or 250 to 300 in total during this time. Now, of course, we cannot be 100% certain these were all due to COVID-19, but it's pretty likely that this was indeed the cause of these excess deaths. The National Institute attributed this to slow reporting processes, just the things hadn't worked their way through the system. But also they did recognize the lack of PCR testing. But why have the figures been so unreliable? Is it deliberate suppression? Could it be unreliable collection and collation methods? Is it resource issues? Some have argued the suppression is linked directly to the Tokyo 2020 Olympics and to tourism. So for example, if you look at the way that infection rates change after the announcement of the postponing of the Olympics in March to 2021, infection rates for COVID-19 jump, and the pattern of increase for Tokyo and for other areas of Japan resume a more, if you like, normal, at least what we thought was a normal increase at that time. Again, one can't be sure this is really the case. It could just be part of the curve of development of the infection at that time. However, surveillance studies scholar Toshimaro Ogura has argued that more generally, there was a lack of preparedness for this pandemic in Japan, and that this was influenced by preparation for Tokyo 2020. So what he argues is that instead of just being concerned with natural disasters and pandemics as the main focus of possible disasters in Japan, there was an increasing emphasis on terrorism. This has started since 9/11, but had been really, really ramped up and increased since Japan had won the competition to get the Olympics. And the shift towards terrorism here as a major concern became more evident, with resources and with role-playing and scenarios and other things, more and more related to biological terrorism and less to natural biological infection from diseases. This is actually in line with the interviews I conducted in late 2019. In fact, not once was disease and public health mentioned as a possible cause of concern for the Olympics. This is, of course, before COVID-19 started to happen. Instead, the entire focus was on earthquakes, which is understandable, of course, and terrorism, which, as many people will know, is highly unlikely in the Japanese context. One can also point to the wider driver of lost tourism, which certainly was a factor in how the outbreak in Hokkaido took place. It was largely around the Ice Snow Festival that takes place in Hokkaido annually, but also the way in which it was actually played down and the focus on hotels and getting hotels back to normal, for example, after the pandemic clearly shows after the outbreak, sorry, in that case, clearly shows an emphasis on tourism as a driver. Maybe it was methods. The government had used a lot of the latest methods, especially in communication and public relations. The line social messaging system, which is ubiquitous in Japan, it's practically unknown in North America. But basically this is a kind of combination of things like WhatsApp and Twitter. It does payments, all kinds of things. It's a Korean system. It's now sort of moved almost wholesale into Japan. It's brought up many other social media systems, including Yahoo Japan and others. But it's ubiquitous. The government uses it non-stop, as many other people do, everybody does, for public relations in this case. But beyond that public relations use of high technology, much of the data gathering and collation around COVID-19 has used thoroughly low-tech methods, pencils, paper, and particularly two things, the fax machine and Hanko. I'm going to emphasize today. Hanko is a very Japanese technology. Essentially, this is an inked stamp that is used to give a kind of bureaucratic confirmation to any document. Without that stamp, information on a document is considered to be essentially meaningless in many organizations. And many documents have to have several Hanko from several levels to be valid. So Hanko has been blamed for the early phase of work from home policies, for example, in Japan. 80% of office workers claimed they had no choice but to go into work physically because they had to use the official Hanko. So even though they were told to work from home, once they'd finished their document, they had to go into the office physically, get their document stamped, which undermines any of this sort of, the effect of these work from home policies. Then there was the fax machine. Faxes, there's a whole history of why faxes are used more extensively in Japanese organizations than any other country in the world of a similar level of technological development. There's some very good books on this. It's not the fax is not used still in some other places. There was even an article recently pointing out in the New York Times that American hospitals also use faxes quite a lot more than one would expect. But this is no way near the penetration of fax machines still in Japanese organizations. And the use of fax has been blamed for many errors in the data that's been published by organizations in Japan. So counting of number of infected people in Tokyo, considered to be copying and recopying of faxes by hand, then faxing them again, having them recopied by hand, and so on. This kind of multiple process, iterative process of faxing, writing by hand, faxing, and so on, has led to many errors. Could it be down to resource problems, the problem with figures in Japan? The Abe government has claimed it discouraged testing because of not only the cluster tracing strategy, but also because the data collection by local government would actually be overly burdensome, would overwhelm local government and local health organizations. Local health activists in Japan, notably Shigeru Wakita, have argued that the lack of capacity in Japan in the local public health system has occurred because of progressive neoliberalization over the last 25, 30 years. In particular, since 1994, when there was a series of laws which basically privatized, neoliberalized, cut resources to various different aspects of the health system. I mean, this was a period, as we'll know in Ontario here, where lots of neoliberalizing activities took place. This was the period of the Harris government here. And ever since then, there has been this lack of resources in the public health system. This is a relative claim in the sense that Japanese public health and local public health still has a lot more money than many other countries. It's not like it's short of money compared to even Canada or the United States or Britain. However, compared to how it used to be, and especially how it's supposed to be according to the post-war constitution, it is argued that in fact this is now breaking and breaching the constitutional requirements. After May, in fact from May onwards, there was a shift in this kind of low-tech response. Various things were promised and various things happened. First of all, following a behind-the-scenes process that had taken place, a contact tracing or contact confirmation app was promised to be introduced. Once again, as we'll see, confusion reigned in this set of developments. First of all, one particular app, Memoriai, created by a non-governmental organization called Code for Japan, which specializes in public data and so on. This was reported as being in development, and then it was announced as being official by the government, and then nothing happened. It was quietly shelved. It's still actually very difficult to find out exactly why. I'm waiting to get a contact with the CEO of Code for Japan, and hopefully I'll find out exactly what's gone on. Instead, another app called Coco, connected to Microsoft, although not apparently officially, certainly Microsoft engineers were largely involved in this, and a private consulting company called Persol, which I'm also trying to find out more about, was launched as the official app out of nowhere. Apparently this had also gone through a process of development over a long period, but it was not the official app until suddenly Memoriai was shelved. So there was a whole series of confusion around that. At the same sort of time, it was announced that the online reporting system that's used, especially for reporting infections and death in Tokyo, would actually be replaced by an online reporting system, a database system, instead of a fax-based system. However, just yesterday and the day before, I've seen reports about the second wave of coronavirus in Japan, which is now going on, which make it clear that the fax system is still being used, although apparently the HQ that's looking after these figures now has 2 fax machines instead of 1. That is a kind of, I guess, a very Japanese compromise. What's more, other high-tech government systems that already exist in Japan have also been malfunctioning or not functioning as promised. After various earlier ridiculed compensation schemes, which I don't have time to go into today, the government had introduced a one-off, roughly $1,000 US equivalent compensation payment. This was supposed to happen through this relatively new government service identification system called My Number, which has been widely opposed by many people in Japan as essentially a government surveillance system. This was completely unable to cope with the demand and essentially collapsed. People were not able to get their compensation, leading to many delays and complaints, and people essentially going back to the snail mail and fax to send in their applications. So here we are at the end with Shinzo Abe on the left and Aso Taro on the right, deep in conversation, one imagines, about the terrible accusations that have been thrown against them. Here we are back to Mindo. If we can't explain Japan's relative success through government action, which seems to have been confused and uncertain, if we can't explain it in relation to other kinds of factors, maybe we can explain it through sociocultural means. And there is a widely circulated proposition that Japan has several sociocultural traits that makes infectious disease spread less rapid and wide. Most significant amongst these are an existing propensity towards social distancing and reserve. So this is true in my experience as well. There is very little to no public skin-to-skin contact in Japan, even amongst people who know each other well. And people generally try to keep a certain distance even when they're forced into very tight situations. So for example, even on very tightly packed trains, my experience is that people do not touch each other skin to skin. It's very, very unusual to do that. Except of course, for people who are doing things they shouldn't be doing. Second factor is supposed to be everyday hygiene. Frequent hand washing is supposed to be one of the factors, taking off shoes before entering houses and so on. Certainly the latter is very much a factor and true. The former, as we'll see, is more debatable. And finally, personalized or at least social responsibility for disease prevention. So non-medical face masks have been normal for a very long time in Japan for anyone with a cough or a cold or so on, largely to protect other people from yourself, which is of course the main purpose of non-medical face masks and the one that many Western people seem to find it very, very hard to get to grips with or to understand. So I argue actually the face mask may in many ways be the most important technology deployed in Japan to fight COVID-19. Now, cultural factors may often be dismissed by observers seeking more clearly measurable reasons for Japan's relative success, but formal studies of things like face mask wearing, Wada et al. In 2012, have been left to conclude essentially that it is a major factor, and it may indeed be one of a constellation of similar kind of social hygiene factors, but it is a factor, absolutely the case. And we're seeing more and more evidence now as a result of COVID-19 that face mask wearing is an effective measure, and people are slowly, who are fighting it earlier on, are slowly starting to give in to this reasoning. However, there are problems with all of this. First of all, there's a problem with cultural hypotheses in their ability to be captured by nationalists and racists, Mindo, again. So we have to unpack these things further and see what exactly is going on inside these cultural hypotheses. There's also, of course, not just positive sociocultural factors, there are negative ones as well. Many people will know about the widespread reports there have been of bullying of people suspected of being infected with COVID-19 in workplaces and others, and even of healthcare workers in Japan. This is completely different from many other countries in the world where people have tried to celebrate frontline healthcare workers. Very much not the case in the Japanese context, and there have even been, as I said, these cases of bullying of healthcare workers. It's also the case that many broadly voluntary measures to control movement, for example, during the COVID-19 outbreak in Japan, have been far from universally observed. Basically, people have continued to go into work for various reasons, some of which are not their fault, as we've seen. But people have continued to travel around in ways that they were encouraged not to do so. And of course, as many people are thinking to themselves right now, especially any people from Asia or who study Asia watching, most of these sociocultural factors cited are not unique to Japan. And Japan does not necessarily even offer the best example in each case. So, for example, comparative research shows that Japan is actually remarkably poor when it comes to hand hygiene, even in hospitals, and there's several papers that have shown this. Another factor, for example, mask wearing is not just normal in Japan, it's normal in many East Asian and Southeast Asian countries when it comes to disease. So Taiwan, South Korea, others have already normalized mask wearing as well. And in fact, they've also done, by the way, much better, both of them, than Japan, for different reasons. So then let's look at Japan's place in the world, in Asia. Unfortunately here, I don't know if it's the same for you, but my camera is covering Japan and the places I'd like to compare to Japan too. But Japan, this is a map of total deaths per million by country. Japan is 8, by the way, 8 per million per Japan. And as you'll see already, Taiwan is 4, China is 3, Vietnam, by the way, is 0. This is not because it has no data, it's because it absolutely actively claims to have had 0 deaths. There are debates about that, there are some skepticism about that, but it's certainly one of the countries that claims to have very low deaths. As we can see, New Zealand 4, Australia 5. So within the Asia-Pacific, East Asia-Pacific context, Japan is not actually the best. In fact, it's distinctly in the average region of COVID-19. Japan has been successful if one compares it to Western countries. And I'm certainly not trying to claim in my talk it's uniquely incompetent, by the way, either. It's not the other direction here. And if I was going to want to live in a country right now with COVID-19, I'd rather take the Abe government compared to the Trump government, the Johnson government in Britain, or Bolsonaro's government in Brazil. Absolutely, I would. But compared to other East Asian, Southeast Asian countries, Japan is simply average. It seems that Japan's Mindo is not so fantastic after all compared to that of Vietnam or Taiwan or China or even to Australia or New Zealand. So Aso's typically overconfident nationalist statement, which, as I've already pointed out, was made in the dead center of the eye of the storm between the first and second waves, which are now, looking like they might actually go higher than the first wave, the second wave, really does not hold up. what we need to be able to find are common and probably varied factors across all countries that have been relatively successful. I can guarantee you that Mindo will not be one of them. That's where I'm going to finish today and deal with hopefully questions that we might have in this context.
Thank you very much, David. That was a very interesting talk, and I'm going to take the right of the host to jump in with a question directly related to your last statement about finding similarities, and that is, I had noted that Shigeru Watika had talked about the lack of PCR testing and other capacities in relation to the cuts to public health over the last, or like the medical industry over the last 25 years. And I was wondering whether you would venture speculation about trends on a global scale. It seems to me that at least in capitalist countries that don't have a history of socialist-oriented public health or public health as a good over profits, many are actually quite hard hit. An example that maybe is more similar to Japan is Italy, where many have argued that the cuts made it the case that they were so unable to respond. And then on the flip side, you have some seemingly surprising countries, examples because they're poor, like Ethiopia and Cuba, and both of them have done very well because they have this public health oriented background. And I wondered if you wanted to talk a little bit about that.
Okay, yeah, I could venture some personal views. I mean, I'm not an expert on any of those other countries at all by any means, but I mean, Cuba is the country that nobody's talking about, right? Except for those who know, because Cuba's actually been nominated for a Nobel Peace Prize. People may not realize this year, because it's not only done extraordinarily well with dealing with COVID-19 inside Cuba, it's also been sending doctors all over the world, including to Italy and other countries, which is supposedly more advanced than Cuba. You know, as a result, has had probably a profound effect on fighting the virus throughout the world. And I think, you know, that is exactly, it's exactly because of that public health orientation. It's been a fundamental factor of that country's, you know, idea about itself, education, public health. I mean, there's, you know, whatever else is going on, right? It's not to endorse any of the other aspects of Cuba. This is not about defending one system or another system. It's to say they care about public health, right? They always have done. Shared with Vietnam, shared with New Zealand, in fact, as well, which has a similar orientation. Now, New Zealand, of course, people say, well, it's remote and it's a long way away. And, you know, same you could say about Cuba too. It's a long way away and, you know, nobody goes there. It's under embargo. You know, you could say those things, but then Japan is also a series of islands, right? And, you know, it's done slightly less well than both those countries, although much better compared to someone like Italy or Britain, or even Canada. And Canada likes to say that it's done fairly well compared to the USA, but you compare it to any country in Asia, Canada has not done well. And I think we were talking before the talk started about this. When I came back from Japan to Canada at the beginning of March, there was nothing at the border, nothing. Sorry, there was a table with some information leaflets. That's what there was about COVID. You know, and I couldn't believe it, actually. I could not believe it compared to the, you know, what was going on in Japan, however incompetent, however slow, however muddled, at least, you know, the government was acting, was doing something. It didn't appear that anything was happening, and it didn't happen for another 2 or so weeks after. So I think what we've seen is a lot of complacency amongst countries who just believed in their own superiority as well. I think there's certainly a lot of that going on. A lot of complacency amongst countries who thought their systems were just better or they were just better. It's certainly not only Taro Aso who believes in a kind of Mindo. I mean, Trump has talked about nothing else really, hasn't he, in some ways? You know, that's exactly what Trump believes in, is that kind of American Mindo. Bolsonaro in Brazil believes in a Brazilian Mindo. Hasn't got him anywhere. In fact, Bolsonaro himself has COVID-19 at the moment. And from, you know, so I think I definitely agree. There's been a better performance by countries with a tradition, or at least a recent tradition of public health as an emphasis, who haven't gone down the neoliberal route, or who have had a significant concern with biosecurity. And that's where I think Australia and New Zealand fit in. They are absolutely paranoid about biosecurity. You know, you throw away every vegetable you've got, you know, any vegetable or fruit you've got on you when you go into Australia and New Zealand. It's agriculture as well as human health. So I think those things are both very, very important.
Mm-hmm. Fabulous. Thank you so much for that. Yes, I was wondering, in your talk, you also touched on economics, which you also just did in your answer, but I wondered if you would go back again to the connection, or the I'm not finding the word, Schnittstelle, the connection between opening and the economy, and what kind of debates and discussion were going on in Japan around that, in regards to, yeah.
That was actually one thing I didn't talk about. There's a whole other set of debates going on at the moment, in fact. And one of the other things that happened in May, a lot of things happened in May to June when they were in that lull period before the second wave in Japan. And one of the things that happened was that actually the government abolished the medical advisory committee that it had been relying on since the beginning, that had devised the cluster analysis the cluster tracing solution, and replaced it with a mixed advisory board that included more economists. And therefore, they immediately started to suggest opening up the economy, schools reopening, all of these kind of things. And almost immediately, a second wave started after those solutions, you know, came into effect. Now, it may be that the second wave would have happened anyway. We can't tell because, you know, we've only got this to deal with. But it does seem a bit of a coincidence that the second wave would start so closely after the, you know, so the ending of the state of emergency, the opening up of the economy again, and a more economic-oriented, you know, advisory committee being put into place. So certainly, I think that's absolutely important, and I really think that, you know, we should beware economic experts, and I see a lot of them on the radio, hear a lot of them on the radio in Canada now, especially talking about COVID-19. None of them have got any background in research into COVID-19 or into public health. These are all people just basically saying, I'm an economist and I think it should be this way.
Yes, there's been some interesting work that came out of Germany that I happen to know about, that exactly paired medical experts and epidemiologists with economists in order to answer the question, what should the reproduction rate be in order to best serve public health and the economy? And the answer they got was 0.7. So if you can infect 0.7 or fewer, then it's the best, is optimal for the economy as well. There was some reporting that came out of a U.S. institute that came to similar conclusions, that I believe was in Financial Times or New York Times, so something that perhaps the U.S. government doesn't read or believe in, so maybe not being so influenced by what seems to be a pretty good collaboration between exactly experts that are then using their ideas in order to come up with really the best case scenario. Interestingly, Cuba is still in phase 1, although they haven't reported any cases in the last few days. So perhaps because their economic system is differently organized to some extent, they see the primary benefit of basically eradication before reopening. So they're aiming for a number much lower than 0.7. But I'll stop there, although I will make a plug for the Nobel, I think it's Nobel Cuba, is what you could put in order to sign that petition if you believe in it, if you believe in supporting the brigades. And we have a question that I'm just gonna, there's just, I guess that David just answered those two. Did you just answer those two questions?
I just said somebody wanted to know what the definition of biosecurity.
Great, tell us, yes.
I mean, basically, when I talk about biosecurity, what we're talking about is measures to make sure that materials, whether it's animal or human diseases, related materials, stay out of a particular country or place. Or measures are taken to control those. I mean, in the case of New Zealand and Australia, it's very much about a perimeter. It's very much about stopping things coming in, which is why you're asked to throw all your fruit and vegetables in a bin when you enter Australia or in New Zealand, why you're not allowed to bring any agricultural material in, why if you have a bicycle with muddy tires, they will take it out and spray everything. So yeah, and the same kind of thinking here was applied in the case of coronavirus in both those countries. In the case of Australia, I mean, very early, Australia hasn't actually been talked about enough. They really acted quickly in an early way to control the outbreak, and they did extremely well. Taiwan, of course, too, but Taiwan, of course, not even allowed to be a member of the World Health Organization because not recognized by China as a country. But yet it's, and actually wasn't allowed to take part officially in all the kind of negotiations and medical research that's been going on, even though they have been pretty much the best, in terms of their response in the world, unless you think the figures in Vietnam are as good as they say they are. I think Vietnam's done very well. I just don't believe it's got 0 deaths and no infections.
We were chatting before the talk about the school situation in Japan. What is Japan deciding to do about schools? Since I asked because the question of school openings for younger students is really one of the hot button issues, since it basically allows for high quality daycare such that people can go back to work. So I wonder how Japan is dealing with that.
Well, in the first place, what Japan did was it didn't actually institute a national kind of closure of schools. I mean, this has been the same with a lot of measures that Japan has taken. They're very strange. Basically, the Abe's government said he would prefer it if schools closed. And so different local education authorities took their own decision as to whether they would close schools or not. Some closed all their schools, some took partial closure measures, and some didn't close at all for quite a while until they realized they really had to. What's happened now is pretty much all schools in Japan are now open already. And we're right in the middle of a second wave. It's particularly interesting because the second wave in Japan, and I'm not a doctor, so I've got to be careful here what I say here, but as far as I'm aware, the second wave in Japan seems to be mainly affecting younger people. And it seems to have been largely centered around entertainment districts. That's the euphemism, by the way. A lot of very dubious clubs in Tokyo seem to have been involved in the second wave. And which of course are the kind of places frequented by politicians, which is another irony. But and generally people in their 40s and younger seem to have been affected by COVID in the second wave, which is why there are fewer deaths in the second wave, but many more infections. But that also means that it's quite likely that schools will be loci for infection in the second wave, and yet they've all been opened. Now, there have been various measures taken within the schools, social distancing within classrooms. A lot of teachers actually in Japan, the responsibility for preparing classrooms has been entirely downloaded on teachers. So they've been frantically, cleaning, disinfecting their classrooms, building DIY kind of barriers around desks, all of this kind of stuff. It's been entirely downloaded on teachers. I mean, if anybody knows the Japanese education system will know that a lot of teachers work really hard anyway in this context, doing things that, that people in the West would regard as being somebody else's job. I mean, they do a lot of stuff that is just ridiculous. And here they're basically acting as public health workers as well as teachers. It's they're doing a hell of a lot. And kids are going back to school. So that's how it is. We'll see what effect that has on the figures for COVID infections in the next few weeks, I guess.
Speaking of masks and not wearing them, because we're recognizing now how much masking has to do with infection and masculinity, I wonder if there's a similar phenomenon if you've noticed any gender-specific.
There is in Japan, yeah. I mean, I would say that in general, mask wearing is a pretty wide social obligation, but it's not universal. And if you look at it is a lot smaller number of people who don't wear masks when they should in Japan, but if you look at the people who don't wear masks, I absolutely say that the greatest number of those are men. And they tend to be, there's all kinds of stereotypes about what kind of men those are, which I'm going to try and avoid, indulging in, but certainly they're men, usually middle-aged men, middle-aged corporate kind of people. And those sorts of people, but that's in the context of there being a vastly greater number of people who wear masks overall. So most people of either gender have accepted the logic of this a long time ago, which ironically, by the way, came into Japan from the US and Britain and other places in the 1918 influenza pandemic. It wasn't a Japanese thing before that, and it only really took hold much later, actually, in the 60s and 70s and into the 80s. For various other reasons. So it's not like this is some kind of deep cultural thing that has always been there. I mean, I saw one ridiculous comment from some guy who was claiming to be a Japan specialist talking about how Asian people believe that spirits come in through the mouth, and this is why they wear masks. And it's like, that's exactly the kind of Orientalist bullshit that we don't need in this kind of conversation. It's like, this is not the case. This has already been a transnational phenomenon. You know, it's gone back and forward. There's no reason why it can't come back to us and can't come back to the West. It's not like some, we did it before in the pandemic in 1918. You know, people over here were wearing masks. It wasn't seen as unmasculine. It was seen as like life or death. And that's how people should see it. Are you going to kill your neighbor or not?
Yes. I wondered, David, do you have any final comments that you'd like to make, considering that we aim to leave well before the end of the hour?
No, I don't think so. I just think that apart from the fact to say that I think it's really worth paying attention to a multitude of different cases around the world, not just the ones that we're told to in the media. Mm-hmm. We still have there's so many theories floating around about why some places have done better than others. And I haven't even mentioned some of the medical theories. Like some people think that, countries which had the BCG vaccination still have that have done better than others. And it seems there's a correlation, but, of the small investigations I've seen, it seems to have very little explanatory power. But my general inclination in these cases is to think that it's never one explanation. Maybe as a sociologist, my inclination is to say it's very complicated. This is what we always say, right? But I think it is, and I think there will be many explanations that will overlap. In some countries there will be one kind of explanation, in another country there'll be another kind of explanation. Sometimes they'll have things in common with another country, and sometimes they won't. I think we may be heading down the wrong alley if we think we're just looking for one single sort of explanation that'll do everything. Mm-hmm. So I think that nuanced empirical approach, looking at different places and different policies, different countries, is the way to go.
Mm-hmm. Yes, that's great. And as you've been also talking about in your talk, thinking about where are the narratives coming from, and who are the actors behind them, what might be the potential benefits that they would have to make certain arguments. We have a hand raised. Ultimate hour. Kate, join us. Can you speak?
Sorry, I raised my hand in error.
No problem. It added a nice flourish to the end of our event today. Unless you'd like to add anything else.
At least it shows the hand raising thing works.
So we learn a bit about technology. Thank you very much to Kate for coming, and all of our other participants who came, and of course to our speaker, David Murakami Wood. Thank you very much for that very interesting discussion, and we hope that everybody will be able to continue to tune in on Tuesdays at 4. Then our next talk is also surveillance with David Lyon, who I believe is in your department as well, David, yeah, right? So yeah,
he's my boss. But no, I mean, I wasn't talking surveillance today at all. Of course, I could in the future if we need to talk more about the surveillance issues in Japan. But we'll maybe do that another day. I'm looking forward to David's talk next week, and I hope everybody else is too.
Great, thank you very much. Bye, everyone.
Bye.